Are you thinking about treating your hearing loss but unsure how to find safe and effective help? The truth is, choosing the wrong path could do more than just waste your money. It could silently increase your risk of dementia, brain atrophy, and lifelong cognitive decline. That's not a sales pitch. It's scientific reality. A landmark study from Johns Hopkins Medical Center found that even a mild, untreated hearing loss can double a person's risk for dementia. For those with severe hearing loss, the risk could jump to 5 times higher. But the good news, there's a proven, medically sound approach that not only restores your hearing, but protects your brain health for the long haul. We now have compelling evidence that treating hearing loss is one of the most significant and modifiable risk factors we've ever found for protecting your brain health. I'm Dr. Layne Garrett, founder of Timpanogos Hearing Tinnitus, with over 20 years of experience helping thousands of patients get real results. In this video, I'll break down the 3 most common options for treating hearing loss and show you exactly which one gives you the best shot for long-term clarity, connection, and cognitive health. Let's dive in. To truly understand the danger, you need to understand what's going on inside your brain when you can't hear properly. It's not just about missing a few words. This is a silent, daily battle with real consequences. There are 3 major threats. First, cognitive load. Your brain's like a computer. You've only got so much RAM. When hearing is normal, understanding speech is often effortless. But with hearing loss, your brain has to work overtime, guessing at words and filling in the blanks and just straining to try to keep up. A neuroscientist friend of mine compares it to driving down the freeway at 60 miles per hour in second gear. You can do it for a while, and there will be consequences. Second, social isolation. As hearing becomes more difficult, conversations get frustrating. You miss the jokes, you feel a beat behind, and you start pulling away from social situations. And here's the problem. Social withdrawal is a major risk factor for dementia. Your brain needs engagement with other people to stay sharp. Third, brain atrophy. The parts of your brain responsible for sound literally start to shrink without stimulation. So hearing loss is not just about your ears, it's about your brain slowly losing vital functions. If you could do me a favor, I'd appreciate it. If you could hit the like button on this video, it really helps others find the content and receive proven, scientifically backed information about hearing loss and tinnitus. And don't forget to subscribe to the channel with the notification bell checked. Thanks. Okay, let's look at the first option to treat hearing loss, over-the-counter hearing aids. They're cheap, convenient, and easy to get. Over-the-counter hearing aids are getting better, and for some mild hearing losses, they can be an okay choice. But that convenience can give you a false sense of security while leaving the real problem untreated. The biggest risk? No professional diagnosis. You're self-diagnosing, and hearing loss might just be a wax buildup, or it can be something far more serious. Second, over-the-counter hearing aids are not fit to your hearing loss. They amplify sound, but that doesn't always mean clarity, and they don't reduce cognitive load. Third, you're on your own. No follow-ups, no adjustments, no follow-up care. Studies show that most people using over-the-counter hearing aids set them well below their prescriptive targets. They can easily miss those targets by 20 to 30%. Got a question. Would you accept having your blood pressure medication off by that much? With over-the-counter hearing devices, you bought a gadget, not a medical treatment. The second option, what I call the retail model, is what most hearing care practices follow. It's a step up from over-the-counter hearing aids because you will get a hearing test and some help to get your hearing aid programmed to your hearing loss. But this path is still risky because it's fundamentally a sales model, not a healthcare model. The main goal here is to sell you a hearing aid. The hearing care professional will typically perform the tests only required by law in order to fit a hearing aid. Think otoscopy, looking in your ear to make sure it's not wax. Pure tone audiometry, hear the beep, press the button test, and they'll also check your ability to understand speech in quiet. They also will normally offer some follow-up care to adjust your hearing aids, and they may do some annual hearing tests as well. But vital verification tests like real ear measurements are oftentimes skipped, so there is no way to know if your hearing aids are actually fit to your specific ear. The goal of their annual hearing test is often to have you come in regularly so you will want to buy the next new hearing aid when it comes out. This model is built around product cycles, not on your personal health journey. While it is better than guessing with an over-the-counter hearing aid, it still often falls short of treating hearing loss as the serious medical condition that it truly is. The focus is often on the product, not on your brain, and not on your long-term health. If you're finding this information valuable for your hearing health, please take a second to like this video, and don't forget to subscribe to the channel. We're focused on giving you evidence-based insights that can truly make a difference. This brings us to the third and final path, the medical model. This is the gold standard and the only approach that treats hearing loss with the seriousness it deserves. The difference in philosophy is night and day. The medical model recognizes that hearing loss is a chronic medical condition, only behind heart disease and arthritis, and it needs to be diagnosed, treated, and managed over time, just like you'd manage your diabetes or high blood pressure, rather than just focusing on selling a hearing aid. It all starts with a comprehensive diagnostic evaluation. The audiologist will follow audiological best practices by running a full battery of tests to map out your hearing precisely. These exams go way beyond the beeps and understanding speech and quiet, and includes tests like tympanometry to rule out problems with your middle ear, otoacoustic emissions to test the little hair cell nerve endings in your cochlea, and they will include speech understanding in noise. And because hearing loss is linked to cognitive decline, many leading experts now recommend that a cognitive screening should be part of a complete hearing evaluation. These tests are designed to spot any medical red flags that a physician needs to check out before a hearing aid is even considered. Next, the audiologist will develop a treatment plan based on your specific hearing needs and the results of your tests. If the treatment plan includes prescription hearing aids, they will program a pair of hearing aids from the multiple different hearing aid brands that they work with. Following the medical model means that the audiologist should have many hearing aid options, not just focus on one specific hearing aid company. Think of it like this. If you have high blood pressure, the physician will choose one specific medication over another based on your specific health needs. But it doesn't stop there. They also will perform a procedure called real ear measurements to verify their hearing aid prescriptions. This involves placing a tiny microphone in your ear canal with the hearing aid in place to see exactly what sound is being delivered to your eardrum. The shape, size, and length of your ear canal does affect how sound works in your individual ear. Real ear measurements allow us to fine-tune those hearing devices to perfectly match your prescription. This verification step is absolutely critical and is the single biggest piece missing from over-the-counter models and retail models. It ensures your brain gets the clean, clear signal it needs. But the biggest advantage of the medical model is the ongoing care. You will need some help adjusting to hearing well again. A hearing rehabilitation program is also a critical part of your success. If you've had your knee replaced, the surgeon doesn't just say, "Congratulations, you're good to go." They have you work with a physical therapist to strengthen your knee and regain your mobility. Your auditory system will need that same kind of help to maximize your success. And lastly, your hearing will change over time. In a medical model, you have a healthcare partner for life. You'll have regular follow-up visits to monitor your hearing and brain health. They will also do regular tests to make sure your hearing devices are functioning correctly. And your audiologist will adjust your hearing devices as your hearing needs change. At Timpanogos Hearing Tinnitus, our treatment plans are developed in a way that allow us to even change to new hearing aids as technology improves without increasing the cost to our patients. It's a true partnership, not a product push. So, those are your three options. Take a guess with over-the-counter hearing aids, make a transaction in the retail model, or get real ongoing care in the medical model. The first two might leave you thinking that you've solved the problem, when in fact your brain is still straining. This isn't just about your ability to hear birds sing again. It's about protecting your brain, staying engaged, and staying sharp. And while future treatments like stem cell therapy are on the horizon, they're not available today. Right now, your next step matters. Don't gamble with your brain health. If you or someone you love is showing signs of hearing loss, your first move should not be a store shelf. It should be with a comprehensive evaluation with a provider who follows audiological best practices and the medical model of care. In fact, a study published in May of 2025 from the University of Iowa and Vanderbilt University found that people fit with prescription hearing aids obtained using best audiological practices and the medical model were 3 times more likely to use their hearing aids compared to those who purchased over-the-counter hearing aids. Sadly, industry studies are finding that only 15 to 20% of hearing clinics are following best practices and the medical model of care. Be sure to ask your hearing care provider the right questions. Do they do more testing beyond the basic hear the beeps, press the button, and repeat the words in quiet tests? Do they work with more than one hearing aid manufacturer? Do they perform real ear measurements? And do they offer hearing rehabilitation? If the answers to any of these questions is no, they are a retail hearing aid clinic. Now, I'd love to hear from you. What questions do you still have about treating hearing loss the right way? Drop them in the comments below. Thanks for watching.